Hello, welcome to Relievo Physiotherapy Health Clinic and Slimming Center. First of all, I want to introduce myself. I am Dr. S.S Pandey and I have done the Master Degree in Physiotherapy in Orthopedic Specialization. I would like to introduce you all about my clinic, which is established in year 2007. We have a team of physiotherapist, of fitness trainer, of therapy assistants, health visitor, as well as the massage therapist. From the establishment of our clinic, we had a very good number of patients which is being treated, and the work was very wonderful so that they get cured. And now a condition is like in year 2012. Since today we have a very good number of satisfied patients. We are working as a team. We have a physiotherapy team, we have a slimming therapy team, a well-trained therapist, as well as a very good massage therapist in order to treat the patient. Since from the establishment we have tried to give a very good response. We are treating orthopedic conditions, we are treating neurological conditions, we are treating burn cases along with the sports injuries patients, musculoskeletal problem related problems which is being treated, along with the gynecological problem. As you all know, the number of patients are increasing with the problem of low back pain and knee arthritis. Those patients are taking care related with their health, but which is not very good. I find these problems are not a only medicinal problem. We as a physiotherapist want to suggest to those patients to do the medicine treatment, but along with the physiotherapy will give a very wonderful response. Nowadays there is a major problem of muscle injuries and the poor postural attitudes, like the patient are developing a postural deformities. These postural deformities is just because of the table sitting work, like office work, computer work. They are just going to a very hassle life, and due to the poor road, the patient are suffering a lot of these sort of disorders, and like their health are going worse and worse. In such condition, the physiotherapy is a very good, and it is a sort of very good treatment to all the person who are doing the hassle life style. My mean to say, like a lot of orthopedic conditions such as arthritis, lumbar spondylosis, cervical spondylosis, musculoskeletal problems such as tennis elbow and golfer's elbow, these all are conditions are treated by the physiotherapist, and the patient who are taking a physiotherapy treatment need not to be worried, because the physiotherapy treatment is a totally having a no side effect as like a medicine does. So I suggest to all of you, like physiotherapy is a very good concept. As you all know, the physiotherapy is totally based on the exercise therapy and electrotherapy. The exercise therapy by the mean of knowing your health condition, and we all justify like what sort of exercise to be done. We have very specific exercises which is only for the regional pathologies such as the tennis elbow, golfer's elbow, like orthopedic conditions like a sort of arthritis like osteoarthritis, in which the patient are suffering and doing a prolonged medication, and those medications are not giving a very wonderful response. But I say, like orthopedic conditions, neurological conditions, gynecological conditions, post-operative conditions. In all the conditions, physiotherapy are a very proved and scientific sort of therapeutic treatment in which there is no side effect at all, and we are not doing a medicinal treatment. We are just giving a sort of exercise therapy and electrotherapy. In our clinic we have a very good advanced modalities through which we treat to the patient, and these modalities having no side effect to the patient. The patient who come to us, we are capable to take assessment, and through the assessment we justify like what sort of problem patient is having, and through that we set the goal of the treatment and we start the treatment. After starting the treatment, we observe the patient daily, weekly and monthly, and finally we take the conclusion like how much pain or sort of problem is being decreased, and further we leave the patient when his problem sorted up, and we advise home care activities to the patient in order to protect, and further like patient will not have any problem, we set the living style to the patient, through that he can live a very happy living. Neurological conditions such as Bell palsy, facial palsy, peripheral nerve disorders, we are going to treat the patient along with the rehabilitation part. A patient having a sort of stroke in which he develops hemiplegia, paraplegia, quadriplegia sort of disorders, and we are a physiotherapist which is going to give a very wonderful response to those patients who are suffering with this problem. The chest physiotherapy, what we know like we have a very definite roles in chest physiotherapy of lung problems such as asthma, pneumonia, bronchitis, pneumothorax. The patient who are admitted in the hospitals, we are going to give them a chest physiotherapy along with the postural drainage to those patients who are suffering. You all thinking about the role of gynecological physiotherapy, like what the gynecological physiotherapy is. Like I would like to say, like a patient who undergone normal delivery or a cesarean delivery, in this we are suggesting exercises to them which not only strengthen your abdominal muscle, even the sutures regions such as pelvic floor muscles become very weak. Those ligaments to be strengthened, and it is being suggested by the physiotherapist. So welcome you all to my clinic, and our clinic is going to resolve your all the problem related what you are suffering from. As I previously told, like we are dealing with all the sector of medical problems, so you all directly come to our clinic, and our clinic having a very good response, and you will be totally satisfied. We have just started yoga and stress management. These are really going to benefit you a lot, and we are getting a very good support from Dr. S.S Pandey, who is MD Neuropsychiatry from the BHU. Thanking you all.